nurses and future nurses. Welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I'm going to teach you on how to administer oral medications to a conscious patient and a patient that cannot swallow tablets, right? So sit back, watch this video to the end. Make sure you like, share, and subscribe to my YouTube channel, and I know this video is going to be helpful to you. Next thing is for us to know our set requirements for this procedure, and of course we have tray containing medication, a two bowl containing soapy water and clean water for rinsing of cups and measuring cup. The next thing is at my bottom shelf I have glove, receiver, and another bowl for used cups, sachets of tablets, and towel to clean the patient's mouth. That's face towel, and then a towel to protect the patient's gown. The next step is for us now to identify patient. Remember, when you're carrying out a procedure in nursing, you must identify the right patient so that you can carry out the right procedure on the right patient. When you want to achieve this, you have to ask the patient to tell you his or her full name and date of birth. So now, good morning. Can you please tell me your full name and your date of birth? So when the patient tells you his or her full name and date of birth, then you cross-check on the patient folder or on the system, on the computer, right? So you check and cross-check again. You cross-check twice. So I've done that already, and I've checked that this is the right patient. I'm going to administer this medication, and I'm checking the patient's medication, prescribed medication. So the patient is placed on levofloxacin 500 milligram, metronidazole 400 milligram, and syrup vitamin C. So now the next step is for me to go and prepare the medication to the patient. So I have to perform hand hygiene. Of course, that's the next step. So follow me. Let's go and perform hand hygiene. I'm done performing hand hygiene. So the next step is for us to don glove. So I'm donning my glove, preparing for this procedure. So since I'm sure that this is the prescribed medication for this patient, so the next thing is for me to crush the tablet. So remember, do not pound this way. Just press and crush the tablet, and crush this tablet gently. So as you can see, I have crushed my tablet and dropped the pistol inside the receiver for used instruments. Then pick the mortar, turn the crushed tablet inside a cup, right? Inside the cup, discard the mortar. So it's for me to mix the tablet with water. So stir it up, make sure that the powder is dissolved completely. So prepare another water for the patient to rinse his or her mouth after taking the tablets. So the next thing is for us to take the medication prepared. Put the spoon inside receiver for used instrument. Then position our patient. Please, can you sit up so that I'll give you your medication. Remember, this you are due for medication, right? So you assist the patient. Now you have to place the patient in a comfortable position. Of course, sitting position is a comfortable position. You remember the condition of this patient warrants us to make the patient seated. So I'll bring protect the patient's clothing. Remember, this is a dummy. And then bring the medication, that which I have prepared, and I'll give if the patient can. So you ask the patient, let it give the patient the medication so that the patient can swallow and drink it. Then if the patient's done, bring a cup of water rinse the cup that you prepare the medication, give the patient again. Drop the cup. The next thing is for you to give patient water to rinse his or her mouth and drink the water too. So we are done. So make the patient comfortable by placing the patient back, either in dorsal position, supine position, left lateral or right lateral, depending on which position the patient wants. So the next thing is for me to rinse the cup in a soapy water. Remember, I have the soapy water, and then rinse the cup again in clean water and place the cup. So the next is for us now to administer syrup to this patient. Remember, when any drug that you want to administer to any patient, of course, you have to check the expiration date, the color of the drug. Remember, you have checked the right patient. You have to observe the 5 hours. That's the right patient, right drug, right time, right dosage, right? So you have to check the right, of course, this is the right drug. I have administered the right tablet already, and I'm checking the color of this syrup is the normal color, and then I've checked the name is the right name. And now the next thing is for me to open this bottle. So there is a technique for us to open bottle syrup. Use your hand, open, then use your little finger like this. Hold the cover like this, your little finger, your non-dominant hand, making sure that you turn the label to your side so that it's not spill and stain the label. Remember, we need the label so that we can be checking the expiration date, the right drug, right, the right way. And then use your dominant hand, pick the measuring cup. We put what is it? We put 10 ml of the syrup, put it in a saucer, close the medication immediately. You close the medication immediately, and then take the drug, the syrup together inside a saucer to the patient. I want to position my patient in a sitting position so that I can serve. So you have to pardon me, this is a dummy. Sometimes a dummy will not sit properly like a human being. So you bring the syrup to the patient, right? The syrup to the patient. Of course, I have my syrup, 10 mils here. Offer it to the patient. If the patient can't, you can give the patient to take by itself from the saucer. And if the patient cannot, you give to the patient right to the mouth. Let the patient drink it. Remember, this is a dummy, of course, it cannot swallow. So put it back. I'm done serving this medication. Take it back. Remove the towel and to protect the patient garment, and then place patient back on either dorsal position, left lateral or right lateral. Are you okay? All right. So the next thing now is for me to discard my use equipment. Of course, I'm discarding use equipment. I will rinse the measuring cup in a soapy water and in clean water. I rinsed my saucer too in case of any spillage, and I place it back, making sure everything. Remember, this is OSCE. You don't have to discard all the equipment. You have to rearrange it back so that the next candidate will come and use the same equipment, right? So I'm going to doff my glove, discard in a trash can, and I'll go and perform hand hygiene. So the next thing is for me to document. Of course, I have administered 3 medication: metronidazole, levofloxacin tablet, and vitamin C. So I have to document, write the name of the medication, all the dosage, the time, and then write my sign to indicate that I'm the one that served the medication. Please remember that any procedure that you've carried out, always document, because any procedure that you do not document, that means that procedure has not been carried out. So document properly in right chat. And in case if your hospital is using computers, go into the computer, input the necessary information, click where you opt auto click, and sign there. So as you can see now, I am done serving this medication. I hope this video is helpful. So please do not forget to like, share, and subscribe to my YouTube channel. I love you all and I wish you the best of your luck in exams.